I've been in isolation with my family in northern New South Wales with a single support worker since March, due to being a high risk as a result of COVID-19. It was recently reported that there were 71 cases of coronavirus in disability residential accommodation settings, including group homes in Victoria. Many disabled people are unable to effectively use social distancing, especially if we share support staff with other people in the community. Some people are being locked in their rooms and are unable to leave except to have a shower. Why aren't more people talking about this?
Dinesh.
Sorry, that question came across a bit distorted in my sound. Would you mind repeating?
I can just repeat it for you. Obviously, there's great concern about people living in disability care arrangements. There's been some cases in Victoria already. The questioner, Kelly, has been in isolation with her family in northern New South Wales with a single support worker since March. She's at high risk. But she's making the point that many disabled people are unable to effectively use social distancing, and that some people are being locked in their rooms and unable to leave except to shower. She wants to know why this isn't being talked about more.
Yeah, this is a really important issue that we need to talk about. I mean, we've talked about aged care homes, we've talked about the elderly, but people with disabilities are in the same group. And there's such a complex range of issues that they face. Even for me, example, I have help from my mom and people around me every single day. So social distancing is difficult. And there's a support structure in place that requires physical assistance. And some people require 24-hour care as well. I have a friend who needs someone around 24 hours a day. So that has implications with PPE, for example. And I've heard stories about people that have disability support organisations attending their homes, but if they develop a cough or a fever, they stop attending. So now suddenly these people are left at home without any support, which is a significant issue. If I was left in that situation, I would be in some serious trouble. So I think these are things that we do need to have a conversation about and at least have a plan for how we're going to support people and manage people in these situations. But it's a conversation that's ongoing.
We've heard a lot about breakouts of COVID-19 in aged care facilities. I mean, would it be a similar situation, do you think, if there was an outbreak in a disability care facility?
Yeah, absolutely. And I did read somewhere that there have been some outbreaks in disability care facilities. It's really a similar situation as aged care facilities. And that there have been a lot of concerns even before COVID about how people were treated in those facilities. And that they're really a physiologically vulnerable group as well. So we definitely need to think about that.
Michele O'Neill?
Yeah, I just want to pick up on Dinesh's point there. This is a very real risk for disabled people, and many of the workers in that disability services have been raising this because we've seen an outbreak in a number of facilities here in Victoria, and we've got the same profile in terms of workers that are working as disability support workers as well as workers that were working in aged care. So we've got a large number of people who are in insecure jobs, casual workers, workers who are low paid and who aren't recognised for the incredibly important work that they're doing. These are people's lives that they're caring for, and the situation that Kelly's in is a terribly difficult one for her and her family, but also for the people working with her. So we need to recognise that we may all be in this together, but the virus does not treat us all the same way. So the fundamental flaw that's been exposed about insecure work and how that has led to greater vulnerability in terms of spreading of the virus, people not having the support they need to be able to stop, get tested and then get be able to isolate, proper paid pandemic leave being in place has been a huge flaw in our defence, a hole in our defence against COVID-19. And we know that if we're going to build back out of this and come back, we have to address those inequalities that have led to the flaws that we're now seeing in our defence. And that means thinking about, do we really want to have those two classes of workers? Do we want to rely on the care for our elderly, for disabled people, for our children, to be also people that are in insecure work, paid some of the lowest wages in the country, and not recognised for what they do? This is something that needs to change for the long term.
I understand you're drawing the comparison with the aged care sector, but to be clear, the Health Department did produce a plan for disability care in April in relation to COVID. It's called Management Operations Plan for People with Disability. There's a great deal of detail there about some of the issues that you've just raised. Tim Wilson, it was referenced at the Royal Commission today into aged care that there was no plan, or alleged at least that there was no Commonwealth plan for aged care. Why was there for disability but not for aged care?
Well, you got right to the point, which is this is an allegation. In fact, you can go back to March and you can find guidelines by the Department of Health to assist aged care providers in managing these challenges. So there clearly were measures in place. Now, if the person wanting to make that allegation is free to do so, the facts simply don't support them. The point of the Commonwealth is to work directly with the providers to make sure they do have the assistance and support they need. And in fact, we've implemented measures every step of the way and given any support and assistance every step of the way. But
if there was a clear plan about what to do when there was an outbreak in a nursing home, for example, then you wouldn't have state governments making decisions on the fly about whether to take those people out of the nursing home or to leave them there. I mean, these are the sorts of details that should have been in place early on, shouldn't they?
Well, there were clear guidelines about how aged care should manage it. Now, one of the things the federal government has had to do is work with the state government. They had to push it very strongly in Victoria to defer elective surgery to make it possible for people who had conditions in aged care the support they needed in public hospitals. So at every point that there has been an option, the federal government has intervened to support and assist aged care providers, but it's a combination of factors that address it. And the problem that we've had... So
are you saying there was an equivalent of this COVID plan for disability services in the aged care sector? Are you claiming that there was?
Well, what I'm saying is that back in March, there were guidelines that were clearly put out by the Department of Health to assist aged care providers. The problem that we've had in outbreaks in aged care has been... Well, the guidelines have been clearly there, so the assertion is false. And what we've had is a problem of outbreaks that have come from patients who've been leaving public hospitals as well as community transmission that has led to the situation in aged care. And so we've got to look at the cause of the problem, not just simply see the symptoms, to see how to stop it, to address it, and to make sure it's fixed. Now, we could just throw everything at the state government because they run the state hospitals, which is where there have also been outbreaks, but it's to go through each measure and identify where we can provide support and assist people in aged care. I've spoken to local aged care providers in my electorate, and many of them operate, and many of them, through luck, have been able to avoid this community transmission coming into their home. But sadly, some of them haven't. And the focus has to be on how to get those measures in place to support those who have.
Okay.